Oh, yeah.
Oh,
I'm an administrator, so I couldn't get away.
ladies and gentlemen,
Hit your gavel.
I'll wait. I'm going to call this meeting to order, please. Richland County Community and Health Affairs Standing Committee, March 5, 2026, 9:30 a.m. Roll call, please, Derek.
Miller,
Here.
Kramer,
Here.
Engel,
Here.
Hendricks, Harry,
Here.
Dwyer,
Here.
Barris, Brathwaite,
Here.
and Chicker.
Here.
You have a quorum.
Thank you. We have verification of open meetings law compliance.
Yes, Madam Chair, the meeting is public.
Thank you. I need a motion to approve our 14-point agenda.
So moved.
I'll second.
Great. Has everyone had a chance to look at the minutes from our February 5th meeting? Is there any changes, additions, deletions that you would like to talk about? Hearing none, minutes will stand as read and presented. Any public comment this morning from anyone? Anyone online? Mary? Got anything
No,
to say?
not me.
You
no.
have sunshine. You have sunshine.
You have what?
You have sun out there.
Yes. Yeah, we do. 80 degrees.
Oh, no. Well,
Sorry to hear that.
yeah.
And there's a few.
Moving on, we're gonna go to reports. We'll start out with the Health and Human Services Director, Administrative report, please.
Sure. So in the packet, there's the typed up updates in the ADRC. They're going to continue with their Rise and Dine starting again in March at the Phoenix Center because it was so successful last fall. Men's Shed is going to start next week. Very excited about that. Highlight and behavioral health. No details as far as numbers they're seeing, but it's busy business as usual. Child and youth services. Update on reports. Nice to see that we only have a couple of kiddos in out-of-home placements, which is exciting to see. Economic support. They're continuing to meet and exceed benchmarks in their call center activity. And other work that they're doing. They are fully staffed except for the one vacant position we did not budget for 2026, and have their two newest staff that are on the call center now. So that's exciting to have all staff on the call center calls. Public health, I got all fancy on us this month with their unit update. Scroll up there.
Sorry.
Yep, nope, that's okay. They got all fancy on their update, so just wanted to highlight no measles in Richland County, but of course Brandy's keeping a close eye on that, and just wanted to make sure to highlight immunization clinics and immunization clinic getting out there, people getting their MMRs. Otherwise, I think the biggest thing I just want to, you might start seeing some ramp up of some tick bite prevention outreach. We got a small grant to go ahead and be able to do that. So you'll start seeing that at like you said, you'll prepare signage, get repellent dispensers out at trailheads, things like that. And just a heads up for next month, April is Public Health Month. And Brandy, the unit managers, invited someone from the state. I can't remember who she invited, but they're going to come and they would like to present to the committee on public health next month. So,
Okay, nice.
yeah. Any questions or thoughts? I got a couple of managers either online. That's Roxanne here. Anybody have any questions?
I guess just a general one from the county board perspective. So we hear things like it's smaller meetings, the subcommittee meetings, like 40% of Richland County has a hard time making ends meet. Rise, elderly, women, poverty, inclusive, not providing, we're going to cut transportation costs, etc. I tend to think we don't hear that enough. So we're about to make decisions on levy and stuff. While at the same time, we're not aware of the needs. So I'm wondering, just how often we should be hearing that from the Health and Human Services.
As a whole,
Yeah, at the county board level, about the need, growing need. Because it is getting worse out there. So mine's more of an educational question. For the homelessness. Just whatever it is.
And my question or comment comes mostly from, and I guess it would be through the public health arena. More the concern about and not just the measles. Granted, we haven't had any instances here, but with the growing number of instances, both in the state and especially and nationally, wondering what, if anything, is being done with local healthcare providers to really push not just measles immunization, but overall immunization, both childhood and adult, given that we are one of the lower areas with immunization rates.
I know Brandy's, that she's not on right now, but I know she's been having some conversations with the hospital to see what more can be done as far as potentially outreach with organizations. Or are you on there?
Yeah. Hi. Can you hear me, Stephanie? I am on.
Yeah, okay. Sorry, just didn't see your name.
That's okay. I don't know if you can see me. I took myself off video and off of mute.
Now we can see you.
Ah.
Yeah.
I guess, do you care if I speak just for briefly about that remark,
Oh,
that
that's
question?
great. I didn't see you, so I was trying to be you. So
It's more a question than a remark.
Yeah. I guess I'd like to say that we are aware that vaccine rates generally seem to be lower. And I guess I don't have a good answer. We are actually hoping to maybe examine and collect more data about that and collaborate more with our local health system. I do want to say that we have Vaccine for Children program, Vaccine for Adult here at the county that is specifically for our uninsured and underinsured populations. I do know that our local health systems, I just don't want to speak on behalf of them. I'm not an agent of the Richland Hospital or clinics, but even our surrounding health systems, they do have vaccines available. And I guess the other thing is, talking to my county leadership, we've discussed the need to have these what are called tabletop and functional exercises to discuss, like, if a measles outbreak were to occur, right? And so we are actually in the planning phase of that. That's something that actually our local health department took part in collaboration with Sauk County in January. So we are aware, it's a lot of situational awareness right now. Like I mentioned in my updates, there are no reported measles cases as of now in Richland. I guess to reassure you, I think there is opportunity for more collaboration maybe between public health and our health system. And that would be maybe our goal moving forward in future months. So, and just, keeping an eye out for any help maybe or assistance from the state as far as funding to promote immunizations and prevent communicable diseases.
Any idea as to the why behind a low vaccination rate? Why are parents not seeking vaccinations, or is that part of the data collection?
I think I don't feel comfortable saying exactly why. I don't want anything to be misconstrued out loud. I can speculate all day long about why. I think that maybe gathering a little more specific data to present would be more helpful and more specific, and I would feel more comfortable doing that. I do generally know anecdotally that I don't believe we're seeing as many families coming in recent months, and I can't tell you exactly why. I can guess why, but I don't want to. I prefer not to say that. That's just not anything that I have any data to support.
Thank you. Any other questions for Brandy? Thanks, Brandy. Anything else,
You're
Roxanne?
welcome. You're welcome. I heard you. Thank you.
You're welcome. HHS expenditures report, vouchers and expenditures over 2,000, but less than 10,000.
Might have to change that language, because that's kind of changed a little bit, but I think with procurement and all that, but that's okay. Any questions? I kind of took a peek, nothing really jumps out at me that's kind of out of the ordinary. We put a big chunk of money on our postage meter, but that'll last us a long time. That'll last us quite a bit. Any questions about anything on there? Anything jump out?
Twenty 2025 budget summary and Richland County final 2025 placement report.
Sure. So we just wanted to throw one last 2025 budget report out there and placement report out there. This is where we think we're gonna land, as far as a small surplus. I know 284,000 to you guys doesn't think it's not a lot, but I mean, it's nice. I would say it's more than small, but it's nice. To highlight our expenditures though, we're a little over across all programs, but that's really due to our CCS and CLTS program. That we had a lot of clients that we worked with this year that those programs are growing. And then the surplus, I just want to, that's what happened is we got our 2024 WINCR reimbursements, right? So when I do a budget, we have Human Services creates our budget, we don't necessarily have a good number to plug in there. So we were pleasantly surprised when our WINCR reimbursement was a lot more than what we had anticipated. So that is the bulk of that surplus. So, which is nice because it carries over and gives us a little cushion in the checking account if anything goes on, anything happens. Nice. Any questions about 2025? 2026, we should be doing one next month in April for 2026, but that'll only probably be 2 months worth, so it won't be anything too exciting next month, but we're gonna be done with 2025. I can't think of any other. I'm pretty sure all of our expenses have come in. I think we've got all our 2025 invoices. Still have some trickling revenue, but small amount.
Thanks. Any questions?
Yep.
Dan?
What is the term treatment court? I don't understand that phrase.
Treatment courts?
Treatment court.
We actually have the treatment court coordinator here. Treatment court in a couple of sentences.
Treatment court is a program that individuals are, so going to prison or being incarcerated for a substantial amount of time. It's like an alternative, essentially.
Thank you.
Okay, placement reports for 2025 ending. Those ended in a good spot. As you know, there was a lot of work done in the Child and Youth Services unit to find permanency for children, so that was good to see. We had a significant amount of Winnebago, but we didn't have any necessarily super expensive protective placements in 2025. Not gonna say the same for 2026, giving you a heads up there, because that's just so fluid, you just never know, so.
And it's hard to budget for that.
It's very hard to budget for that, so, right? You just never know. We try to guess what we think we're gonna need. Questions about placements?
Hearing none. You. The Health and Human Service Organizational.
Sure, so we do this every quarter. We try to do this, give you kind of an update on where we're at with each of our units and our staff. Some differences from last month, if we start on the administrative and financial services unit. We lost a physical specialist, but we have a replacement already, Ursula Berry Bauer. She's brand new. She just started Monday. Keep scrolling. Oh,
Tell me when to stop,
huh?
If you want me to stop, stop me.
Yep. It's right there. Aging and Disability Resource Center, no changes. She's pretty stable unit, which is exciting. Then we've got, the Behavioral Health Services unit. Since the last time we did this, we have Tamara Olson, who's the Behavioral Health Unit Manager. It's not highlighted, but Emily Shelton, she is now the lead coordinated services professional. That's a position that was approved for this year in this year's budget. And we just basically took one of our coordinated services professionals and made them a lead. And then we also have two down in the, depending on which screen you're looking at. In the one corner, Samantha Madison is our recovery services coordinator. So she does a lot of peer recovery, works with people in the jail. If we scroll down to Child and Youth Services, had some changing there. Instead of a supervisor for 2026, we turned the supervisor into a lead worker. Shelby Miller applied for that and was appointed to that new position. We've hired Aaliyah Ruland and Casey Banker came back to us as well. So with Shelby moving, so because Shelby was a social worker and she was moved to the lead worker position, her position is now vacant. So we have that posted. Economic support, no changes in there and that unit. And no changes in public health. Any questions about the organization? And all the people?
Ursula Bauer, is she from Kaz area?
Yes, I believe so. Like a town, was she a town clerk maybe? Yes.
Yes.
Yeah.
Thank you. Any other questions? Okay, moving right along, contract monitoring report.
Me again. All right, so this is just our final numbers for 2025. A couple of contracts that were over the 100%. So if we haven't done them already, we'll do amendments. But with the new procurement, unless it's over $250,000 or more, you won't see those come through. There's a couple of them that show that we were invoiced through August, but that's not correct. I did double check that. We are fully invoiced through December on Driftless and then later on Array. And I double checked those numbers and we're gonna be well under 100%, so no concerns there. Any questions about any of these contracts? Committee's always wanted to know how's the money flowing, so
And it's
that's
flowing.
why this report's out there, and it's flowing.
Yeah, it's flowing.
It's flowing. With a highlight, a lot of that's reimbursed through CCS, a lot of these contracts through CCS, so that's, which is nice.
Anything else for us, Stephanie?
No.
Any questions?
Yeah, how's that Mazamani catering working for them at it looks like Simon's Center, I don't know. Roxanne has got 125,000 or 150.
Yeah, so we continue to utilize Mazo Catering. There's 3 counties that are utilizing him, so we all share menus. So it continues to be okay. There's always little glitches here and there, but overall things are going well.
Now, what's a meal there? What are we talking about meals? Is that for the
That's for our
jail?
No, that's for
senior-
our senior dining sites and also for our home delivered meals.
Oh, okay.
Yeah, for our nutrition program.
All right.
Then, Mary, did you have a question on Simon's Recreation as well?
Well, no, I just couldn't figure it out because Roxanne has some coverage of that too in other areas. That's why I asked.
Oh, yep, yep. A lot of the units in Health and Human Services utilize Simon's Recreation for a variety of different programs. So for the EDRC, we utilize them. We contract with them to do our evidence-based programming. We get a little bit of money from the Older Americans Act. And so we utilize them to be able to provide those services because they can do it much more reasonably than what we could. So we're able to offer a lot more programs compared to if we did it within the unit, so.
Okay, thank you.
Yep.
Next up is the Pine Valley Community Village Administrative Report.
So this is just going back on the month of February. So all of February, we had some sort of outbreak happening, whether it was COVID, influenza, we had a GI bug. So we had quite a bit of residents and staff kind of getting sick. We did not have any surveys last month,
We had,
state surveys coming in. We had coffee, we're still doing a root cause analysis and just kind of a fall prevention. We are still working with education on finding those root causes and appropriate root causes. We are working on a bed hold tip now, just making sure we have all of our bed holds in the event of transfers out of the facility. We've implemented angel rounds. So all of our managers take about five rooms in our building and we're all going down, talking to the residents, checking on them, asking them questions, checking like their rooms, and just giving that opportunity to sit down and just kind of see, is there any concerns that we're not hearing? So that started this week. We put it in yesterday when I had the managers meeting. So some of them started yesterday, the rest of them will start today. We're going to do about 2 times a week for a few weeks, and then we'll probably drop it down just so they get used to the idea of us coming in consistently. And then we'll drop it down to once a week, or as needed after, if they need more than just one visit. For staffing updates, happy to say we only have 2 open shifts on PMs for our CNAs. Otherwise, all shifts have been taken by our own staff. Nurses, we do have some availability, but we are very minimal with the agency usage as well. So we're excited about that. There was a rumor going around that kind of came to us inside the building that there were pay cuts happening in the building. However, that was not a thing. We did do the raises in the building, but for some reason that kind of got around. The only time we ever adjust pay is in the event that somebody is doing like an on-call or they're premium eligible because they're not benefit eligible. So they get an additional premium amount. Now, if they were to take a position because they become benefit eligible, they lose that premium pay. So that is the only way anybody would lose money is if they take that position.
But they gain benefits.
Correct, but they gain the benefits. They get the health insurance, the WRS, all those
Sick
things.
vacation.
Yep.
All that good stuff.
Yes.
Yep, so just wanted to make sure everybody was aware there is no pay cuts occurring at Pine Valley. We did implement, so all of our staff, CNAs, dietary housekeeping, we have on every other holiday requirement. So they have to work every other holiday when they're a scheduled employee. For a while, the nurses weren't doing that. They were just putting them on the schedule. If it was their day to work, they were required to work the holidays. I have implemented that the nurses go on the same because some of them don't work a single holiday depending on the way they're scheduled, or some of them have to work all. So we just wanted to ensure fairness across the board. So there was some concerns, and I think it was just kind of understanding that. But we just made sure that it was fairness across the board. It was every other holiday. Facility maintenance, again, we're still working on, like our fire drills. We're planning an elopement drill. We still do the QA rounds, which will be more frequent with our angel rounds because we'll be able to see things consistently. I'm working with the sheriff's department to do an active shooter drill. So we've been working with Mike, and I got him a bunch of policies that other counties use. So we can kind of establish that and create that, because that is one of our, hazard events that could, potentially occur. So we just want to make sure we have those in place. Again, we still have a little bit of issues in dietary, and they're slowly improving. We're still working on meeting, menu planning meetings, and just kind of sitting with the residents to address any concerns and then addressing them as they come about. The ombudsman was out for the last resident council meeting. Again, she's just an additional support, comes out quite a bit, meets with the residents and, you know, is able to assist with any concerns that they have. So, and like I said, with the, you know, any complaints or anything with the implementation of Angel rounds, we're hoping to stay ahead of any complaints that come across.
Okay, I still see that you got that wing door still not done.
So it's, we can only do certain ones when it comes to a spa bathroom. So we're doing a lot of research on multiple different ones. But when we go on like websites to look for a spa bathroom, we have to request a quote, and then they have to come out, and then they have to look at like the area and what model we're looking for. So we're currently working on that. It's just taking a little bit because it's not, you know, we call and get somebody to give us what it's going to cost. They have to
In your wing door,
it's just
no longer making that model anymore, so the whole thing's gonna have to be
correct.
replaced.
We are potentially looking at moving the one off of the assisted living. They don't utilize it ever, so we might just, depending, I'm gonna talk to Natalie about like their actual usage down there, so we might just transition it. And if there's somebody on the assisted living that would like one, then we can look at maybe putting one on the assisted living back. But right now, my understanding is we don't use it very frequently, so it is the same model that we already have in place. So that's something that maintenance and I have been kind of discussing, if we can do that. So maybe save a little bit because they're not cheap.
No,
I think there's one other thing, if you don't mind.
go ahead.
To share. So there's been some discussions out on social media about individuals living at Pine Valley, employees living at Pine Valley. And I just want to provide a little history on what is going on with that and with everything. So last year was brought to my attention that we were having staff members stay at buildings. And I consulted with Corporation Counsel, who said if there are employees who need to stay in the buildings, that is something that we would allow. And I clarified, does that mean all buildings, including Pine Valley? Yes. If they need to stay there, that is something that we would approve. So when in February of this year, somebody was contracted staff from Pine Valley were sleeping in their car, and let's, you know, remember the cold spell that we had earlier this year. And they shared with us, they were contracted staff from Texas. They shared that their Airbnb wouldn't be available for 3 additional days. They said, please come in and sleep in the building. The plan was they were going to stay in the building for 3 days, so they didn't have to sleep in their cars. So we had staff to meet the needs of our consumers. Please keep in mind that anybody who is in that building is fully vetted. So we do the background check, we make sure they're safe to be around people. What we found yesterday was that it was a couple, she had moved out, he stayed. We didn't realize that he had stayed. So he was asked to leave yesterday. I just want to say, you know, there are times that people do spend the night in the building, that employees have to. Highway department sometimes has to because they have to go and plow, sheriff deputies, jailers, because we do need people here. It is not a normal occurrence. It is not something that we encourage, but we do understand that there are times that there may be the need for that. I will talk with our new corporation counsel to see if he advises differently on that, but I just wanted to let you know where that was at. There is a lot going around from what I'm hearing on social media. I don't go on social media, but that's what I'm being told.
That people were angry because they thought somebody was living in a room and with his girlfriend.
It's understandable. Both of them are current. Well, she's almost done with her contract. And again, we're not renewing a lot of our agency contracts because we filled the holes. But both of them are actually actively working. They're fantastic workers. I've heard nothing but fantastic things from our residents, from the staff members, very respectful people. Yes, ma'am, no, ma'am, you know, those sorts of things. The gentleman spent a lot of time with the residents, getting to know them, just kind of talking, just kind of giving that, some of the things that sometimes as CNAs and nursing staff kind of miss because, they're always running, they're always working. So it was just kind of nice. I've heard nothing but fantastic things. So I didn't feel it at that point, when talking to Trish and stuff at that point, I didn't feel like it was a threat to our residents. They're, we screen them for communicable diseases. They were never a threat. We run the background checks before they even came in. So.
Well, I don't think the threat, well, I'm sure some people thought of it, I did, but, what people were thinking, from what I heard, was the cost, like, oh, well, we gotta pay this much to have our loved one, but yet you've got these two people living in one of the rooms. Well, I just don't know how to communicate that. If something like that should happen, I just don't know how we can get it out and about before it becomes a rumor.
Right.
And it just explodes. But this hopefully will not explode, because I asked Tricia to explain it today, because I wanted to make it known that, yes, we do know about it. The situation has been resolved, and Tricia's going to be speaking with our new corporate counsel tomorrow to find out exactly what we should do. I can understand people staying there if the weather is really, really bad. I'd rather see them stay in the building than have them go out on the road and possibly get hurt or killed. That I can understand. But we'll find out tomorrow what our new corp counsel says, but as far as I know, it'll be fine. So.
And yeah, and I looked and double checked, this isn't the first building that does it. I've had buildings where people parked an RV in the parking lot, when they travel significantly far. We look always into the regulations, get, feedback from our DHS state workers, and none of them see an issue with it. The only thing is if, they have a background and thieves or whatever, obviously we wouldn't even employ them. So, we did do due diligence to make sure that obviously it wasn't against the regs, against resident rights. And we were, verifying that, so.
Okay.
There's been discussion about Pine Valley reporting to this committee. And I'm just, when that came up, people were talking about just how much money that would be jurisdiction now. So I guess my question is, if that's the case, who reviews the Pine Valley budget? Like we do with Health and Human Services, would that be coming here too as well? Okay. Who does it now?
The committee does a little bit, and Leanna Peck, our finance director, our finance director, she reviews Pine Valley's budget. So she's done a real deep dive into it. She presented, I believe, in February's Pine Valley meeting.
Yep.
The overall budget, kind of like she did with ambulance at the last meeting. She's done that with Pine Valley too.
So in the future, that will probably be here.
Mhm.
Okay, gotcha.
Oh, and our audit got put on hold, so that was
It
the other
did.
thing. We came in, it got put on hold just because they didn't have everything that they needed, but as soon as they have it, they'll be back.
The one that I attended?
They got about 80% of it done.
Well, for Pete's sake.
There's a few
Yeah.
things on the county end that we need to get taken care of, and then they'll be back.
Okay.
I don't know, you might be reached out to for the cost report. Their plan is to start their cost report in June. I think it is. We'll have everything to them by the end of April is what they're requesting.
Just keep us updated, please, on that.
I'd like to know I didn't hear what the limit is on that. You have, 3 days? Is that what you said, or a week, or what?
We
For
don't
people
really,
staying?
yeah, Mary, we don't really have a limit. Like in this situation, it was 3 days, but the situation last summer was 5 days there, a couple days gone, 5 days there, a couple days gone. That wasn't at Pine Valley, that was at a different spot. And the directive I got again from previous corporation counsel was that it's not anything that we should be worrying about. Again, our current corporation counsel might think differently, and he might recommend that we put a policy in place that outlines, here's kind of the limits that can be, and here's the parameters. But I can certainly come back next month and talk about where we're at with that.
Thank you.
Good call.
Anybody else have any questions for Brittany? Will we let her off the hook? Okay,
I'll be back
yeah.
at the end here.
Oh, yeah. Thank you. All right, number 8, discussion and possible action changing the committee meeting time. I reached out to Miranda and it's in the package. If there was anything in the afternoons, but you guys would have to change your schedule, Stephanie? If we had the meetings in the afternoons versus the mornings? I'll start with you.
If that's what this committee would like, we can rearrange it. I usually keep this day pretty free for me personally.
I don't want to make extra work or,
It would be more ideal to just have it maybe move later in the morning if that works better, because I have it blocked off, but.
Sure.
What would be your recommendation? Time?
I have the whole morning blocked off.
Oh, well, you just said
I usually block,
later.
yeah, I think, later in the day. This is usually committee day, so I don't usually plan too much in the afternoons for myself personally. Some of the managers might hit or miss, but they're already hit or miss now anyways.
Yeah, I thought I heard you say that you'd like it later in the morning.
If later in the morning would be preferred personally, but again, afternoon, I could make after, is what I'm saying.
So the question would be, what time in the morning would you favor?
11?
What'd you say?
11?
I mean, I don't have a preference, right, for morning, right, later in the morning. I don't know if you pushed it to 10, 10:30, 11. I have my whole morning blocked off already.
You're thinking 11?
I just usually go in, I speak with residents and I sit down with them. That was kind of it's a time crunch for me in the morning. Plus we have morning meeting at like 10 minutes to 9. So it's usually pretty much rush or get out before the morning meeting ends to get over here. So that would just let me accommodate, staffing and residential needs.
If it was in the afternoon.
Like later morning is fine too, like 10:30, 11 o'clock. It just kind of gives me that, so I'm not rushing right away in the morning.
Yeah. Rod, any?
I'm old.
You're old?
I don't know why we're discussing it, because after April, half of us might not even be on this committee anymore. Because everything's gonna change after the election. We're gonna be reassigned to different committees, so I don't know why we're even discussing it.
Will the times remain the same though?
No, that'll be one of your first steps, will be determine the date, time.
Okay. Well, just keep it in mind. It was something that
Okay.
I wanted to bring up because I am also rushed in the morning to get here on time. So this morning I had a break, but just keep it in mind if we're all happy faces are back again.
I'd make a motion that we try 11.
I'll try 11.
Yeah, that'd be fine.
Yeah, 11 is good for you, Brittany. We have a motion to change the time for our next meeting in March. This is March, April. To 11 o'clock.
Yeah.
Do I have a second? Will 11 work for you?
I'll second it.
Thank you, Mary.
I was just gonna ask Brandy Anderson, because we had that guest speaker coming. Had you,
Oh.
Brandy Anderson?
Thanks, Stephanie. I will check my message to Joe Larson and see if that's gonna create a problem for him. I did mention the committee meeting date and time. So
Okay.
I'll just mention that the committee is wanting to change to 11 and see if that presents any conflicts for him and get back to you, Stephanie.
Where is he coming? Where is he coming out
So
of?
he drives, I believe, from La Crosse.
Gosh, you'd think 11 would be nicer for him too.
And I can't speak for him. I really don't know. I just know that I communicated to him a specific date and time. So I will double check. I'll double check and let him know.
Okay,
Thank you.
thank you.
You bet.
So Sandy, may I ask for clarification on, is the motion just to change it for the entirety of the standing committee? And no, could change in April, the motion is to have it be 11 instead of 9:30 going forward, if nothing changes even after April, right?
Right.
Just wanna make sure.
And we have a second from Mary.
Yep.
Any other discussion or questions?
Well, I hate to repeat myself, but if
I know.
over half of us are gonna be out of this committee, it's futile to discuss it even, to be honest with you.
That's kind of where I'm at too, as one of the longer term people around the table here. It was hard to get used to a different day of the week of the month. And 9:39 or 9:30 works much better for me because then there's the rest of the day to get stuff done. But well, is there any way maybe we could just change it for April and then we'll wait and see what the committees decide for when we get new people on us?
Good idea.
I think you should put it on the agenda for a future meeting after the election.
Right.
That would be my idea.
So Larry, would you like to amend your,
Oh, I can, sure.
Larry, you want to amend your motion to just, to do it for just next month?
Sure. I just don't-
Okay. Got that?
I'm just trying to honor the staff's request.
Yeah.
It's not the staff that, we're fine with the time as it is.
Oh, just this meeting.
Whoa, the Pine Valley.
Yeah.
stuff. No,
I'm
okay,
just
all
honoring
right,
the staff's request.
sorry.
And are you here every month then? Now on?
We
You're
want
the
to keep
one
the staff, so.
Yeah.
Anything we can do to support them. I'm in favor.
know.
And that just means we might not have our presenter for April from Public Health if it's at 11, potentially, but.
That's good with you? Or it's just next month, 11 o'clock? We still have to vote on it.
Well,
Yeah.
Mary's gonna second.
Yep, Mary, you gonna second
Yeah.
that?
Yes, I will.
Okay.
Yes.
Right. All in favor of having our meeting at 11 o'clock for April? Say aye.
Aye.
I.
Those opposed?
Put a nay in there for me,
Okay, so.
'cause I can't see coming in the middle of the day. Early in the day, late in the day, but not in the middle of the day, because then your day is gone.
Well, we have a tie, so I get to break the tie. And I'm gonna vote yes, change it to 11 o'clock for April. See how it goes for everyone. And then when we get new people on the committee, then change, well, you know, if they wanna change it back or leave it alone, we'll find out. Because Dan's right, a lot of us may not be the same faces. All right. Discussion and possible action, changes to the Pine Valley Community Village Addendum.
So just kind of a back history, we want to make our addendum more appropriate and cohesive to the Richland County handbook. Obviously, we still have limitations of being able to fully integrate to just the Richland County handbook because we have a lot of healthcare policies and, you know, we have a lot of staff that is 24/7. But one of the changes with the wage scale and where people fell, we do have some nurse managers and some staff that are capable of working the floor. That are now only gonna be able to earn potentially comp time. So my goal is to kind of keep things a little bit more cohesive for them. They were used to being able to clock in and collect additional pay for working the floor outside of their working hours. They no longer get to do that, which kind of puts a little strain on them. So our managers stepping on the floor, they're now taking on additional responsibilities to their original job, which is supposed to be, you know, managing our residents and managing the employees down on the wings. I see the struggle right now with comp time, you know, them earning comp time during the week. So I can't imagine, you know, they will continue to earn comp time every time they work the floor. And realistically, them being able to utilize it without cutting off causing shortages other areas, so like their jobs. So if they have to work PMs on a Wednesday, then they're gonna take Thursday or Friday off, and maybe we have 3 admissions happening that day, so now it falls on other people's responsibilities. It creates an organizational stress, in general for just kind of the overall flow of the building when, you know, they have to take that time off. If they work a Saturday, that ends the pay period, they can't comp their time no more. And they should be compensated accordingly for the additional work that they do. So the goal is to give them their hourly, what they would make hourly salary as an additional pay onto anything outside of their working hours. So they have to take a class. They have to be working the floor as a floor nurse, to earn that pay. So otherwise they would earn comp time otherwise. It just kind of creates that they don't want to work the floor if it's just going to be unused comp time. So that's kind of where we're struggling. Trish and I talked about it quite a bit about, you know, making sure we still have that continuity of what we've been supplying them and not taking a bunch of things away and still giving them something that benefits them, but benefits our residents very much so. Try to alleviate those needs of that agency usage.
That's the goal, get rid of the agency.
It is, and we want them, using these staff to work the floor is truly gonna be a last resort. It's not gonna be something that we're working into the schedule, but there are times that they just have to because of that staff demand.
I know our DON has worked night shift recently. Our DON working night shift, you know, if there's a call in and, you know, we've exhausted everything, we've try to utilize agency, try to get staff to stay over, come in early. And sometimes it's just not something we can do. So she ends up coming in, or, you know, our RN managers, there's a call in for PMs. We've exhausted all options and now they're working the floor. So.
Motion
You
to
know,
approve.
And I'll second. Okay, discussion?
oh, I want to say that I am glad to see the managers out working the floor. I have always been a proponent of that. If you're managing something, to know what's going on. And I think it's good for the people working with you to have those managers out there, and they get a little more respect. I think you have 3 managers. Is that not right?
We have our DON and then we have the 2 nurse managers. We are looking at a PM charge nurse just because we have a lot of med techs and LPNs that are working in the building. And we need that RN to be able to complete those assessments.
Oh, I absolutely agree. I think those things are all very important to not just the patient, but their family as well. That they can, if you have a little issue, you can say, well, I'll bring down the RN and they'll talk it out with you. So I think it's good that they're around there. I would like to see them, you know, continue to have some rapport with the families and the patients on a regular basis. So
Yeah, our managers are fantastic. They do have such a good rapport with residents and their family members. Our social workers have such a good rapport. You know, I'm hoping like with the angel rounds that'll also get those additional, you know, our office staff out there so that they also have additional faces to talk to, those sorts of things. We're really trying to make some changes to benefit the building and the residents.
Oh, we had a motion and we had a second. Any other questions or discussions? Hearing none, we'll have a vote. All in favor, please say aye.
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 All against, say nay. Motion passed.
And I have to apologize, I have another place to be at 10:30, so.
Oh my gosh. Yeah, you better go. Is it close?
I'm a few minutes late. I'll be getting it that way. Thank you.
Yes, thank you for coming. Number 10, discussion and possible action, approval of an opioid settlement fund grant application for treatment court.
Sure. So this is actually, I guess we could say it's an addition, an additional request for the national conference. Additional in that when the original grant application was submitted and the dollar amount was approved, there have been some changes in some of the expenses that have come in that are a little bit higher than was originally estimated. I had Savannah come today because she has some additional information that's not in, if you had any questions regarding the information. But primarily it was the hotel rooms, right? Came in a little bit higher than was anticipated. And the registration costs. So they're just asking for an additional $5,000. I think originally they were approved for 17. So.
I was gonna say, we had this before.
Correct. So originally this came forward, there's the team that's gonna go to the national conference. And in that, there was an estimated cost of what everything was gonna cost, and the estimate at the time was 17,000. Now that they've got, the actual information is coming in as far as the registration, hotels, all the things. They're gonna need an additional $5,000. So we're bringing it through as an additional grant.
And the total of what we have right now.
In Fund 990, several hundred.
This
Yeah.
by so we.
Yeah.
5,000.
It's significant. Yeah, this will cover it easy. Yeah.
Motion to approve, as long as they don't go to Florida.
Where is it this year?
Nashville.
Nashville. Okay, we got a motion. I need a second.
Second.
Francis, thank you. Any other questions
Is this a
or?
recommendation to the full board or?
Yes.
Yes.
Yeah.
Yep. Yeah, they gotta approve that. You don't have.
Yeah.
It's really a good thing, they go,
Yeah,
really important.
so we have a first and we have a second to approve it. Any other questions or discussion? Hearing none, all those in favor, please say aye.
Aye.
This will go on to county board. Thank you. All right, 11. Discussion and possible action regarding employees volunteering for community services. If I may start, we have an individual who works over at HHS, and would love, and I don't know if she's doing it now or not, volunteering at the food pantry. She is helping out with the Spanish-speaking people that come through there. The problem is that, she doesn't get off until,
I think her shift is like 4 to 4:15. So it's,
she would be missing, this is my opinion on it. If you compensate one person, then you gotta compensate them all. And if she has to miss a few hours at the food pantry, so be it.
so just so you know, this is not the employee asking for this,
No,
right?
right.
This was somebody from the community was, asking if Health and Human Services would pay this individual to work at the food pantry.
No,
Um,
for only that hour or whatever.
I'm not sure for how long or whatever, or, but historically, managers, if an employee says to their manager, I would like to volunteer at this, at work organization XYZ, not necessarily just the food pantry. That is something that they can work out with their manager. They can flex their schedule. They are more than welcome to use, benefit time if that's what has to be done, but I don't know, that, yeah. The managers in this situation, it's just a conversation with the manager and they could flex their schedule if that's something that, works for operations. So,
I think it can be resolved at that level. And we should-
it can be resolved at that level. I think to just allow this is, from Health and Human Services, to just allow just one individual to do this. It can get complicated too, because we're paid out of specific our programs have certain requirements, right? So I can't pay somebody to go work over here when this is the pot of money that they're paid out of, right? Because of, as you know, grants and things like that, it's very specific on the scope of services. So, so for some individuals, there would be this back and forth and it'd become a payroll nightmare from a grant perspective. So, so it gets complicated that way when you're right, Larry. It's at the level of a manager can make that determination. And I think they can do that across all departments, I would think, Trish, right? Depending on operations. It's not just health insurance.
Yeah, because we don't wanna keep them from volunteering in the
Correct.
community. But at the same time, you know, if you read the handbook, it's like, you know, this takes, yeah, so.
Right, so.
And when I was in the office, I did the same thing with my staff. If they had something that they, you know, that they wanted to go do, we would work it out in the schedule.
So it just kind of started here as a place for discussion in case it wanted to become something more formal at a county-wide level.
We just wanted to make you aware that, and, you know, I don't want to keep her from working at the food pantry. That's her desire. That's her desire.
Okay.
Make everybody aware.
And I can let the manager know that you guys are okay with that.
They probably feel better. Okay, thank you. Any correspondence? None. Future agenda items.
I think that education, the county board, in terms of what's happening out there in the community is important. So we've been hearing it at subcommittee level, but we haven't heard it full board. So it would be, you know, the 40% that can't make ends meet, the homelessness, just a short update to let people know that it's getting more difficult out there for folks
Are you wanting that at this committee or at the county board?
at the county board.
Oh, okay.
So I can have a discussion with Dave and ask him to get it on the agenda.
For how often does this committee report like that to the full board?
So we,
I would say that typically they don't, you know, with those issues that are happening, typically that doesn't happen for any of the standing committees. Reporting up, it's more of that policy procedure. I think what the thought is, you're informed of that information at this level, and that drives the policy procedure that you send the full country.
Yeah, these seem to be extenuating circumstances, so because things are getting worse. Anyway, okay, I'll do that.
so it was like a county board education.
Anything else for future agenda items?
Public health presentation, if he's able to make it.
Yep.
What was the name of the presenter?
Joe Larson from DHS.
Brittany, anything special you want on the agenda for next month? All right.
Sandy,
Yeah,
is Brittany still there?
she is.
I would like to ask her a question, and I think maybe it was it should be for Pine Valley meeting, but I'd like to know the perspective going forward, you know, with medications and treatments and whatnot. Are we preparing ourselves for what's going to be down the road? I'm seeing patients now that at the hospital that are having antibiotics frequently, not enough nurses to do it at Pine Valley. Is that in our thoughts for the future? And if it isn't, can we really progress?
So you're saying can you repeat the question about the antibiotics? You're saying the
Well,
hospital-
there's so many new antibiotics, and I know that patients want to go to the nursing home or they want to go home, but to the nursing home they can't go because they don't have enough RN help to do these updated antibiotics and treatments that are coming out of the hospital situations. People aren't staying in the hospital anymore.
So
and
we
Okay.
do IV antibiotics in-house. So we do all antibiotics in the building. We do 3 times a day. I think our limit is like 4 times a day, like where we wouldn't be able to take somebody, but yeah, we take IV antibiotics. We do have RN coverage 24/7 in the building. So they are able to manage. We do, educate our LPNs, so LPNs can do it with the education. The only ones that aren't able to do it is med techs, and if we have a IV antibiotic or, antibiotic that needs some sort of specialized care, we would not put a med tech down on that wing.
Okay, what about PIC catheters?
We do pick lines, we do pretty much all of them. The only time we have to send them out is like, let's say their pick line is clogged and we can't do a flush on it. Then we send them up for them to get a heparin dose, but we now have it with the pharmacy where we can do the heparin push right in house.
Okay, so I won't go any further here, but you and I need to talk when I get home.
Okay.
I have a few other questions, but I'm just holding up this meeting. So let's go with that now. Thank you.
You're welcome.
Thanks, Mary.
Uh-huh.
Okay, I need a motion to adjourn.
I'll give it.
Okay, need a second. Mary, you want a second?
Okay, I'll second that motion. I'm ready to go. Thank you.
All in favor, please say aye.
Aye.
All opposed, as a good friend of mine would say, you may stay. Thanks, everybody. We'll see everybody at next